Hi there, this is Dr. Ma'in Hasib again, the accreditation consultant and quality and safety trainer on another subject on accreditation and quality in clinical laboratories. This is lesson one, a new topic, starting a point of care program, what you need to. In lesson one, we'll talk about what is point of care, to point of care or not to point of care, what is required for point of care testing. In lesson two, we'll continue what is required for point of care testing. What do you need in order to establish a point of care program? How to achieve equality in your point of care testing, and a subject summary. So let's start with lesson one. Testing at the point where patient care is given, wherever that is located. That's what point of care is. Testing at the point where patient care is given, wherever that is located. So it's in ER, the ward, an ambulance, okay? These tests are generally performed by staff not formally trained in the clinical laboratory as a medical laboratory technicians or medical technologists, such as nurses, patient care techs, and respiratory techs. Point of care techs have been available for more than 30 years. Example of point of care sites or locations: in the doctor office, in surgery, in bedside, in emergency room, in the field like in an ambulance. Example of tests that can be done as a point of care: blood glucose, lipids, cardiac markers, hemoglobin A1C, pregnancy, blood gases, and many, many more. To point of care or not to point of care? Well, point of care often start without knowing if the test is appropriate for the setting or not. Many times there is a limited understanding of requirement for accreditation, training, documentation, and procedures at the end user side. There might be several types of instrumentation performing the same test in various areas of same facility. There may be no evaluation or comparison. There is no validation. There is no verification of the values obtained from these different methodologies, and they may not correlate well with each other. They might even have different reportable ranges. Cost savings that may be available through quantity purchasing may be lost. It is important that a point of care program at any of the above site is carefully planned. What are the advantages of point of care testing? Speed, turnaround time, fast turnaround time. Point of care average turnaround time is 8 minutes versus 59 to 60 minutes in the lab. Therapeutic turnaround time, 8 minutes versus 1 hour to 8 minutes versus 1 hour and 25 minutes. Dummy proof, usually. Dummy proof means they are easy to use, okay? Just push buttons, basically. Might not need permanent dedicated space that the lab requires. You can carry it wherever you want, or if it needs a space, it will be a small space, okay? The entire process: collection, analysis, repeat analysis if needed, immediate result review, and patient's education feedback are at or near the patient's site. Likelihood of wrong result is minimum, or it's not going to be serious. Another advantage for point of care testing is reducing hospital length of stay. Also, fewer unnecessary admissions, reduced blood volume used. Okay, these are all advantages of point of care testing. What are the disadvantages of point of care testing? It could be inaccurate or less accurate result. Patient than the lab testing. It could be costly. It is not totally under the control of the lab, so they cannot monitor everything closely. Hard to keep track of inventory and supplies. Hard to monitor and track of QC and maintenance. Hard to keep track of end users, the staff. Cooperation of end users might be an issue. Sometimes they don't cooperate, they don't comply, they don't listen. Testing is performed by non-laboratory staff. Hard to keep track and perform the end user training and competencies. End users might take shortcut when doing procedure, not following the policy, the written policy or good laboratory practices. So these were the disadvantages of using point-of-care testing. Now we're going to talk about what is required. If you want to establish a point-of-care testing, what is required per CAB standards. And point-of-care testing has a separate checklist called point-of-care testing. So in point-of-care testing standard 0680, it says there are records to identify point-of-care personnel that are authorized to perform each wave and non-wave test. And I recommend an employee roster, okay? An employee roster for that, okay? Next one, point-of-care initial training. Point-of-care 0680, it says here there are records demonstrating that all point-of-care have been satisfactorily completing training on all instrument, method, or specimen collection technique applicable to the point-of-care testing that they are going to be performing or doing. You're going to need a written procedure for that, and you need record for the training. So on the same employee roster, you can indicate the date that the nurse or the end user training date. Some notes. Prior to starting a point-of-care testing and prior to reporting patient result of new method or instrument, each individual must have training and be evaluated for proper test performance. The record must cover all testing performed by each individual. Training record must be maintained for a minimum of 2 years. After the initial 2 years period, record of successful ongoing competency may be used to demonstrate the compliance with this requirement. Retraining must happen if the end user failed their competency. What else required in point-of-care testing 06875? It's required you need to do competency assessment for wave test and non-wave test. If they are doing wave testing, you only need to do annual competency, and I recommend observation. You only need to do observation. You don't have to do all the 6 elements we discuss in the competency lessons. You just do observation for that, okay? You need a written policy and you need the record of the competency. Again, you don't need to have all the competency record. You can, on the same employee roster that you have, where you put the dates of the training, you can put the dates of the competency when they were trained. However, the nursing educator, nursing manager, they need to keep the record of the training and the record of the competency just in case the inspector would like to look at it. And you need competency for non-wave testing, which is mentioned in point-of-care 06910. And for non-wave testing, you treat it like the lab. You need the 6 elements, and you need to do semi-annual and annual competencies. And for more information on that, if you want to learn more, you can refer to the training versus competency lessons. I already mentioned that to you. I already talked about that, and this is the form you're going to use for non-wave testing for point of care. Okay, for point of care who are using non-waved instruments or methods or tests. What else required? To summarize, the training and competence required for point of care. For staff performing wave testing, they need initial training and they need competency every year, annually. Okay, and we said the laboratory director might select element to assess for each test system, and I recommend observation. Okay, the qualification of individual assessing competency of wave testing or non-wave testing must be delegated by the medical director or designee, medical director. Okay, and how do you delegate that? You issue a letter, say I'm delegating the training and the competency assessment for the end users, for example, the nursing manager or whomever is going to be the nursing educator or whomever going to be doing the training and the competency. For staff performing non-wave testing, they need initial training, and during the first year they need semi-annual training and an annual training, and after that they need only annual competency. Let's say for non-wave, if you hire somebody in January 2020, around July 2020 they need semi-annual competency, and therefore first annual competency will be in January 2021, and annual competency thereafter will be January 2022, 23, and so on and so forth. Like I said in my competency lessons, you need a system to remember when you need to do the competencies, especially the semi-annually, because people tend to forget about it. You need a corrective action if they fail their competency, and you need a record of that, and you need a procedure also. Also, the point of care 0692, the qualification of individual assessing competency. We said the lab director must delegate that delegate in writing to the end user or to either the nurse manager or the nurse educator or whomever is going to be doing the training and the competency. He must delegate that in writing. Also, the people assessing the competency or doing the training, they must be knowledgeable in that procedure which they are performing competency for or the training for. You need a letter or a policy or a statement from the medical director for the individuals who are assessing competency and doing the training, and you need record of competency assessment. I am done with lesson 1 and starting a point of care testing. What do you need what you need in order to continue with the subject? Please watch or go to lesson 2. In lesson 2, we'll continue with what's required, and also we'll talk about what do you need in order to establish a point of care program and how to achieve quality in point of care program and a subject summary. Thank you very much for watching.